Hey everyone, the title of the video itself explains what the video is going to be about, and I'm sure you're going to realize its importance by the end of it. You're free to take screenshots of the slides and ignore my talk, but I would suggest you hear me out as I'm going to garnish these topics with some extra advice and tips as to how some of the answers must be written. So, without getting much into your nerves with such a long introduction, let's start. First up in the short notes part is rectum. The exact location, extent, course and direction, and curves, very importantly, are need to be mentioned. The relations of the rectum anterior posterior and the arterial supply, venous drainage, and nerve supply are important. In the anal canal, the extent, direction, length, and the relations are important. Apart from that, interior structure with its diagram of the anal canal needs to be mentioned. Then comes the basic arterial supply, venous drainage, and nerve supply. The most important catch in anal canal is the clinical correlations, which includes the hemorrhoids and other stenosis. Hemorrhoids, we call it in common language as piles. The types of hemorrhoids are also very important. Next up is spleen. Spleen is very important from the histology point of view, and the histological diagram is very important and should be on fingertips of the students. Apart from that, the location, position, axis, borders, surfaces, angles, relations, and the basic arterial supply, venous drainage, and the nerve supply are important in spleen. From the gallbladder part, the location, dimension, capacity, parts, function, obviously the diagram, the various ducts and their sphincter, and the basic arterial supply, venous drainage, and nerve supply are important. Since gallbladder pathologies are encountered as one of the many common diseases in OPDs, so the clinical aspect of gallbladder is very important, and the pathologies related to it are very important and needs to be mentioned. It kind of beautifies your answer. Next is portocaval anastomosis. All the vessels anastomosing with each other, including the various regions and the organs involved, needs to be mentioned. Then is inguinal hernia. It is the favorite topic of examiners from the abdomen part. All the diagrams and all the relations and clinical correlations are very important in view of inguinal hernia. Next is male urethra. All the arterial supply, venous drainage, the diagram, and the relations are very important with the point of view of prostate. Then is support of uterus. Each and every name of the support of uterus is very important. Do it in a flowchart manner or in a diagrammatic manner. All the diagrams related to the support of uterus just beautifies your answer. Next is stomach bed. The diagram is important, and listing all the structures are important in the stomach bed, and nothing much to be said about it. Then is inguinal canal. Same as inguinal hernia, inguinal canal has its clinical importance in the surgical ward. Then is ischiorectal fossa. In this, the diagram is very important and the clinical correlation is important. Then is superficial perineal pouch. Nothing much needs to be said about it as the diagram is important and the clinical part is important. Then comes McBurney's point. It is a clinical question. The length and the exact point where the McBurney's point is present needs to be mentioned. The interior of a urinary bladder is very important. As important as the inguinal hernia. The diagram is very important. The examiner will become so much happy just by seeing the diagram you've made. Then is anterior and posterior relations of kidney. It is a very hit question. It has to be one question in the university exam and it brings much of a score. Then is uterine tube. All the ligaments supporting the uterine tube needs to be mentioned, and all other arterial supply, venous drainage, nerve supply, and all the structures present beneath and above it. Then is testis. The layers of testis, the lymphatic drainage, the venous drainage, and the arterial supply of testis is important. The clinical part is also important in view of hydrocele. Next is suprarenal gland. The location, the separate features of right and left suprarenal gland, arterial supply, venous drainage, and nerve supply are important. Suprarenal glands are also important from histology point of view along with its diagram. In ovary, the location, position, relations, arterial supply, venous drainage, and nerve supply are important, along with the histological features and diagram. From internal iliac artery, all the branches are important. The porta hepatis is important from the view that all the structures going into and coming out needs to be mentioned. The location, relation, and diagram are important. The branches of celiac trunk is important from theory as well as viva point of view, along with its diagram. The contents of spermatic cord is the favorite question of examiners and should be on the tip of tongue of every student. It is important for viva as well as theory, along with the diagram. In the deep perineal space, it is as important as superficial perineal pouch with the boundary content, clinical correlation, along with its diagram. Pudendal canal is important in its clinical aspect as in the surgery of hydrocele, local anesthesia is given there. Its content, extent, location, and diagram is also important. Next up is abdominal aorta and its branches. Mention the name of every artery, the diagram. The examiner loves to ask this question in viva as well as theory. Next is the histology of spleen and ovary. Please thought a diagram and then explain the features. Then is splenic circulation. It is very important if the examiner wants to make the question paper bit difficult. Then is histology of liver along with the features and the diagram. Inguinal ligament is the most important part because it is related not only to the inguinal canal but also to the superficial perineal pouch and the deep perineal pouch in the surgery of hydrocele for the landmarks of examination for hernia. Everything is related to the landmarks of inguinal ligament. Then is epiploic foramen. The contents and the location are important. Then is pouch of Douglas. The location, situation, relations, and the clinical correlation are important. Next are the topics which are important for long notes. Nothing much needs to be mentioned about it because each and everything about the topics are important, including the diagram. So these topics are stomach, duodenum, appendix, pancreas, liver, kidney, urinary bladder, uterus, extrahepatic biliary apparatus, prostate, and perineum. So this was it from abdomen and pelvis. The important topics on other chapters are also available on my channel's playlist. Do check them out and thank you.